Hi everybody, this is a video about symptoms coming on or getting worse after taking a certain type of antibiotic. Just before I jump into the video content, if you enjoy my content, please consider liking, following, subscribing, whatever platform you're viewing this on, whatever the lingo is, just to show my channel a little bit of love. I'd appreciate it. So there's a certain class of antibiotics called fluoroquinolone antibiotics. There are a few members of that class of antibiotic family. There's one called ciprofloxacin, one called levofloxacin, one called moxifloxacin. They go by different trade names. Those are just the generic names for them. And these antibiotics are really, really powerful. They're really good at treating particularly difficult to get at urinary tract infections, certain types of lung infections, certain types of gastrointestinal infections, but they unfortunately are associated with a slightly but still appreciable risk, or a slight but still appreciable risk of certain severe side effects, such as weakening tendons and causing them to rupture while patients are on them. So really, really rare to see that happen, but it can happen, and so as such, a lot of clinicians who are able to prescribe those medications tend to use them a little bit more judiciously because they are associated with potentially more severe side effects than other more common antibiotics like amoxicillin, for example, or azithromycin, or different things like that. So in addition to those very, very rare yet sometimes severe side effects, there are some patients who develop chronic symptoms following the use of these fluoroquinolone antibiotics, and that's oftentimes referred to as people getting fluoroquinolone toxicity, or they call it getting floxed. All these drugs have the word flox in them, floxacin, so they call it getting floxed. And in some cases, it's really, really obvious when a person gets floxed. They go on the antibiotic, they develop a lot of diffuse pain, oftentimes fatigue, brain fog. Those of you listening, where this is a channel that focuses on complex chronic illness, like, oh yeah, that sounds like mold toxicity, chronic infections, heavy metal issues, mast cell activation syndrome, different things like that. It's like, yep, yet another thing that can cause chronic pain, chronic fatigue, neurological symptoms, brain fog, things like that. So in some cases, it's very, very obvious when this happens. In other cases, it is more subtle. And so when I'm working with a patient, and especially if we've been kind of having a harder time getting as much traction, or like as much it's been taking longer than expected to see improvement with the patient case, or they seem to be plateauing, and we're kind of looking at why might that have happened. A question that I'll oftentimes ask patients is, do you ever recall having gone on an antibiotic and feeling worse afterwards and not really fully recovering from that? And sometimes that will yield a yeah. And so then we look back at the records and see, like they'll get a list of what they were prescribed from the pharmacy in question and see, like, oh yeah, I was prescribed a fluoroquinolone. Okay, we're dealing with something related to fluoroquinolones potentially, and so then we can start pursuing that. In other cases, it's much less common or rather, in some cases they'll say no, like I don't remember that. But if it seems worthwhile, depending on the case in question, I'll sometimes ask them to get a record of the antibiotics that they have been prescribed since their illness began, or ideally getting records from, say, even like 6 to 12 months prior to that. It's like, oh yeah, I had like a UTI. Now that you mentioned it, I had a UTI about 6 months before all these symptoms came on, and I took the antibiotic. I didn't seem to have any problem with it, but all these symptoms started creeping up out of the blue for no obvious reason 6 months later. Worth checking out what that antibiotic was, and it may be that it just took some time for the fluoroquinolone to start eroding the patient's physiology. As has happened many times to me when I'm making these videos, I think, oh, I can cover this whole topic in a video that's 5 minutes or less, no problem. And as I see the time creeping up, I realize that was a pipe dream. So I'm going to make this a part 1 of 2 video. So I'll talk about some of the more specific ins and outs of how fluoroquinolone antibiotics can negatively impact a patient's cellular physiology and contribute to or cause some of these various symptoms. So I'll leave it there for now. If you are listening to this and you have experienced fluoroquinolone toxicity, or someone who has, if you don't mind commenting in the posting in the comment section, or commenting in the comment section just about any therapies that were helpful for you, or any little tidbits that might be helpful to other folks listening, that would be fantastic. And if you have any questions about this topic or anything else, then I might be able to tie those into the next part of the video or a future video, please feel free to post those in the comment section below as well. I will leave it there for now.